Hello, good evening, Ms. Robinson. I'm
Hello.
Shannon. I'm one of the nurses here at Kent General Hospital. I'll be taking care of you this evening.
Nice to
Um,
meet you, Shannon.
Nice to meet you, Ms. Robinson. We always like to start off with a health history and environmental slash psychosocial questionnaire to try to get as much information from our patients as possible so we can formulate a proper plan of care.
Okay.
All right, so if you don't mind, I'm just going to start by verifying your full name and date of birth for me.
Okay, it's Cassandra C. Robinson.
Yes, ma'am.
I'm 62 years old. My date of birth is 5/4/1955.
All right. And could you tell me what your current occupation is?
Administrative assistant, Delaware State University.
All right. Okay, so we got 15 questions here approximately. Feel free to answer as thorough as you can so we can get as much information as possible pertaining to your health, all right? All right, first, describe any and all pertinent information regarding your past and current medical history. Like hypertension, any diabetes, any medications that you may take on a regular basis.
And this is my health, right? Not going back in history.
Right.
Okay, pretty much I've been basically mostly pretty healthy most of my life. Since I was in my, I would say my mid-50s, I have been treated for hypertension, for high blood pressure.
Okay.
Other than that, I've had no other issues. I've never had, even though there is a history of diabetes in my family, I have not so far had any symptoms or anything that has made me to believe that I would be what's the word I want to use? Diagnosed with diabetes.
Right. No symptoms at all.
No symptoms.
Dry mouth,
no
nothing like that. Or anything.
But I do have like A1C test done by my physician every 4 months on a regular basis.
What was your last one?
My gosh, I can't remember. At one point it did say I may be borderline, but the last test I had 4 months ago was all normal.
Okay, because we can always correct that through proper diet and exercise too.
And that's exactly what my physician is saying.
Right, it's easy to catch from that borderline point and turn it back around. Okay, good. So it sounds to be pretty healthy other than hypertension.
Other than hypertension, and I also do take medication for high cholesterol.
Okay.
And that was always pretty much borderline too, but just to be on the safe side, she has diagnosed me with Crestor.
Okay.
And that's like a 5.5 milligram pill per day.
Okay. Well, we'll get to your medications too in the next couple of questions, so that's good to know. All right. What types of conditions or illnesses have affected your family members in the past? Now, you just told me some diabetes in the family.
Right, but nothing in my in my immediate family, my mother and my father. Neither of them have been diagnosed with diabetes.
Right. Okay.
My father right now is struggling with COPD, which is complicated by heart. What do you call it?
CHF possibly.
Right.
Congestive
heart failure.
Okay.
Right. My mother does. My mother is being treated with high blood pressure.
Okay.
That's a history, I'm assuming, that runs in our family. She also has high blood pressure. I have a sister and a brother who also has high blood pressure and takes medication every day for that.
Okay, so it's kind of some history of that going on. Pretty consistent in the family. Okay. Nothing too out of the ordinary though, for especially the age bracket we're getting to. All right, and what type of diet do you typically follow on a regular basis pertaining to proportions of like fats, carbs?
I try to be more careful of what I eat as I become older, trying to cut back on carbs, eating more vegetables and fresh fruits.
Excellent.
Basically just trying to keep keep it as healthy as I possibly can.
Right. Man,
so eating more fruits, more fresh vegetables, staying off of processed foods that can add sodium, because I think sodium has been probably one of my issues.
Okay.
If you eat a lot of processed food, you're getting that sodium naturally in there.
Right. All right, and now we got the medication question for you. So list any medications that you take on a regular basis. Doesn't sound like it'll be too much for you.
Just for blood pressure.
Okay.
And that's and Lodipine.
Amlodipine?
AMLOPO. And that's just generic for what was it? What's it, Shannon?
Norvasc.
Norvasc, right.
Yes, ma'am.
I also take the Crestor.
Okay. And you take that at night before bed?
At night, yes, before bed.
That's the best time. They say it causes leg cramping.
Right,
so you tend to take it at night before bed,
nighttime.
you won't notice it.
Right. And I take an aspirin, 81 milligram.
Baby aspirin.
Baby aspirin. That's from that's at my doctor's recommendation, just because
for healthy heart maintenance.
Heart maintenance.
We do the same. We prescribe a lot of that to our patients too on a regular basis if they don't already take it.
Right. And other than that, I just take across the counter vitamins. I take a vitamin D every day.
Vitamin.
Vitamin D.
Okay.
And calcium.
Oh, excellent. Okay, and describe to me any surgical procedures that you've had in the past.
None.
None? Excellent. No C-sections even?
Nothing.
No hysterectomies, partials?
No.
Okay, so no significant surgical history. Excellent. All right. And how would you describe your level of daily activity between work and your personal life?
Not as much as I would like. Most of my job is sitting most of the day.
Right.
But I do try to get up at least 3 or 4 times a day to walk, even if I just moved from one end of the hall to the other.
Right.
I try to take the stairs
instead of the elevator.
Sometimes.
Okay.
I could definitely be more active. That's something I'm working on.
Okay. Me too.
Yeah, definitely. Especially now the weather's getting warmer. Hopefully I can walk more.
Yeah, we can get outside and do a little bit more nowadays.
Right.
Okay. And pertaining to your sleep, what's the average number of hours of sleep and or rest you get on a typical day?
6 to 7 hours.
Okay.
I need more. I should try to get more, but that's basically 6 to 7 hours a night is what I typically get.
And I'm finding about myself that if I get at least 6, I'm typically good. But I need about 6 to 8 myself to wake up feeling fresh anyway. Okay. And do you currently have any existing conditions pertaining to neurological status, cardiac? We already went over the hypertension. Any respiratory or digestive issues? No. Genital urinary issues? No. Kidney function?
No.
Okay. And no problems with ambulation, walking?
No.
No walkers, canes, crutches? No. All right, excellent.
No.
All right, and one of our social questions here is how many times a week do you typically have a drink containing alcohol?
I don't drink, so 0. I mean, you could say 0, occasionally a glass of wine, but only very, very occasionally.
Okay.
Right.
All right, and do you smoke? And if so, how many times a week do you smoke or use tobacco products?
No.
Excellent. And we already went over your current occupation.
Right.
How long have you been at that job?
15 years.
Okay. Plans on retiring at all soon?
Yes, very, very soon.
Good. All right, and what is your race, ethnicity, or culture that you identify yourself with?
Black.
All right, so bear with me, Mr. Robinson. We're almost there. And do you have a religious preference that you favor?
Baptist.
Baptist?
Yes.
Okay. Christian Baptist. All right, and what types of activities or practices do you engage in to better the environment? Any recycling? Any use of like water, special water faucets, water conserving items in your house? Or
recycling.
Okay. Seems to be the main big one that most people are doing nowadays.
I do try to, even like with water, conservation of water. Try not to taking short showers to conserve the amount of water.
Okay.
Turning the water off when I brush my teeth.
Okay, excellent. All right, and what is your highest level of education completed?
2 years of college.
Okay, you got an associate's?
Yes.
What was it in? Just curious.
Secretarial science.
Okay. All right, Ms. Robinson. Well, that's all the questions I have for you for now. And what we'll do is I'll give this information, pass it on to our provider, and he or she'll look over it, and we'll formulate a proper plan of care for you. And we'll get you to come back next week and do a physical assessment of you as well.
Okay.
All right. Do you have any questions or issues you want to address at this time?
No, not at this time.
All right. Well, again, my name is Shan. I look forward to being your nurse. It's been a pleasure, Ms. Robinson.
Thank you.
I appreciate your time, and we'll see you back at the same time next week.
Thank you very much.
Right,
I appreciate it.